Hello. Welcome to Question Strategies for taking the CPC exam, the Certified Professional Coder exam from AAPC. This is actually part 5. Okay, we're gonna start with Jasper, who went to the ED when he fell against a chair and had a 1-inch cut above his eye. The doctor closed the wound over his eye with steri-strips or sterile strips. What code should you use? Well, sterile strips are kind of like tape, so he really didn't use stitches here. And as you go and you look at these codes, I would look to see, okay, I have 99281 and 99282. That's okay. I know that it's a 99, it's an EM code. But then I have 12,001 and 12,011. So what's that about? So if I go to that section, I'll find that that's the closure one, because he did have a cut above his eye. But if you read the information in the beginning of that section with the guidelines and everything, you're going to find that if an actual closure was done with steri-strips or sterile strips and not any kind of stitching or staples, you don't include it. You don't include a closure code. That gets included within the EM code. So what that says to me is that I don't need A or B. There are two codes there. The simple closure and the intermediate closure I don't need because these were steri-strips, they weren't stitches. So I need to look at 99281 and 99282. Well, 99281, oh, I forgot to do our keywords. Isn't that awful? ED sterile strips, one cut above the eye. But anyway, 99281 is the emergency room department, but it says it doesn't require a doctor. But we already said we had the doctor, so we've got the doctor. So, and this is straightforward medical decision making. All he did was close up the cut above his eye. So it's 99282. There's no need for the additional closure code because that closure code isn't needed if stitches or staples aren't used. So let's look at the next one. Ryan had a malignant lesion removed from his back. The size, including margins, was 0.6 centimeters. The doctor performed a simple closure to repair the defect. What procedure codes would you use? Well, I apologize for this one. It's kind of like one we've already done, but we can go through it anyway. The 11,600 codes are for malignant lesions, and we have 11,600 and 601. Now, if I go to that section and I read once again the guidelines in the beginning of the section, I'll find that if the closure was simple, it's included within the code. You do not code for the closure. But if the closure was maybe intermediate or complex, you would code for the closure. And that's what the 12,000 codes are. They're the closure. So we have a malignant lesion. It's on his back. It shows the size to be 0.6 centimeters, including the margins. Remember, whenever they have a malignant lesion, they always go a little bit around it. They create a margin around it. And it's a simple closure. So we need 11601, showing a zero point 0.6 to 1 centimeter excised malignant lesion coming off this individual's back. So let's look at the next one. The anesthesiologist performed anesthesia for a patient undergoing a right knee arthroplasty. The patient has uncontrolled diabetes. What CPT code and modifiers would you use? Well, this is once again me knowing a couple of the modifiers. I know AA means the anesthesiologist himself did the anesthesia. If you want to think about it, anesthesiologist, anesthesia, AA. So since the anesthesiologist did it himself, I see two modifiers here with AA. That's A and B. So C and D would not even come here. And besides, D has a 50 in it. That means bilateral. Only one knee was done here. So it's A or B. So we have one question answered. Now, the next thing is this person has uncontrolled diabetes. Normally, the anesthesiologist will give you the physical modifier as far as, the physical, if they have uncontrolled anything. The way I like to think about it, P1 is a normal person. P2 is somebody who might have a condition, but it's controlled. They can have diabetes, but it's controlled. P3 would be uncontrolled diabetes. And of course, 4, 5, and 6, I'm sure you get the idea. So P3 is still the answer we need. So we got to figure out what's this R? Well, the R is telling it it's the right knee. And I kind of need that because if you think about it, it just says arthroplasty, but it says, okay, well, which knee was it? So the answer here is B, and I forgot to do the keywords. Oh my goodness. It's showing the anesthesiologist performed the anesthesia, and it was a right knee arthroplasty, and the person has uncontrolled diabetes. By looking at the modifiers alone, we knew that AA was the anesthesia, P3 covered actual uncontrolled diabetes, and R for the right knee. So the answer is B. Let's continue on. Hopefully, I don't forget to look at the keywords. And of course, for this one, we don't really need one. What is tinea pedis? Now, remember before I said if you can't find anything, then you need to go to the index and see if you can find some clues as to what something might be. Well, that's what I did here. Now, keywords I really don't need because it's just asking me, well, what's this term mean? So here I'm showing the first image you're seeing. Now, yes, it is athlete's foot, but let me show you how I came from it. I looked up tinea, okay, and it's showing me it right here. Then pedis, referring to the foot. Pedal pulses. So now this still didn't tell me anything. So I went to B53.3, and here it is, the actual tabular index. And right underneath it, athlete's foot. Guess what? That's the answer I need, athlete's foot. So you see, in this case, I did go to the index and it gave me a hint as to where to go in a tabular index. So sometimes you need to go a little further. But I think after that, or after looking at the CPT index, if you can't find it, you may have to go to the swag method. Speculative wild ass guess. So let's continue on. A 75-year-old patient presents to the ASC for a circumcision. It's unfortunate, but I have seen it. The physician performed the procedure without a ring block. The patient received conscious sedation. What CPT code would you use for the circumcision? Well, to begin with, we have a 75-year-old patient. That tells me, well, this guy's over 70, so I'm probably going to need one of them qualifying modifiers. And the case is I do, 99-100. So it's either going to be A or C. Now, what do I have to do? Well, I probably have to look up to see which one of these fits better, 54-161 or 54-150. Come on. And it's 54-150. And the way I found that is the fact that it was without a ring block, and that's where the modifier 52 comes from. It tells you within the actual code itself to use 52 in that particular circumstance. Well, I want to thank you for being part of this little review. I hope to see you in the next one. Thank you.